a lot of us don't think of tobacco as a drug because it's so prevalent, but it does have deleterious effects on the child. So prenatally, it can cause low birth weight, preterm delivery, premature rupture of membranes, which is the breaking of the bag of waters, which can then lead to preterm delivery. It can also lead to placental abruption and placenta previa. Placental abruption is right here where my arrow is. So that's when the placenta starts to pull away from the wall of the uterus. And as we remember, the placenta is the baby's life link, so to speak. So the placenta pulls off, and the baby has no more oxygen, no more anything. And then it also can cause problems for mommy because now mommy is bleeding. So that can be a big problem. And then placenta previa is here, where instead of the placenta being on the back side of the uterus or somewhere else along the uterine wall, it's right down in front of the cervix. And so the baby cannot be delivered vaginally if that's the case. So it can also cause problems where mommy may have issues with bleeding during her pregnancy and other things. So this picture here, we're going to talk a little bit more about it, but these are two babies who are actually the same age. And this is a picture that demonstrates IUGR, or intrauterine growth restriction, and a low birth weight baby. So, so these babies are the same age, but you can see they're definitely different sizes. So tobacco-exposed babies, when they're born, they can have signs of increased stress, tone, irritability, poor self-regulation. Some of these SIDS statistics, 2 to 4 times increased risk for SIDS. Some of this is with tobacco exposure in utero, but also secondhand tobacco exposure as well. And SIDS is the sudden infant death syndrome, which is unfortunately exactly what it sounds like. Sudden death for reasons unknown to be determined, and the